Welcome back to the Practice Pulse, where we help owners of private medical and wellness practices scale their revenue and patient lifetime value by implementing smart systems. Today, we are honored to speak with a leader who has mastered the art of transforming a practice through a unique philosophy. I'm thrilled to introduce Dr. Jill Ombrello from Central Dentist. Jill, thank you so much for joining us.
Thank you, Nancy. I'm so excited to be here.
And Jill is out in Texas. And so we were just talking about some ice and snow that she's experiencing. So we're both enjoying, some homeschooling.
A little bit slower pace, a little bit colder weather and time to get caught up. So it's nice a little bit, but I'm ready for the
Yeah.
sunshine.
Me too. Well, awesome. Dr. Umbrello, why don't you start us off by telling a little bit about your background and kind of what led you to start Central Dentist, and then a little bit about the foundation of Central Dentist.
Yeah, absolutely. So all my patients call me Dr. Jill. I'd love for you to do the same, Nancy. It just makes it easier. As my background, I'm a fourth generation dentist. So I grew up, you could say it's almost in my blood. My father, my grandfather, and my great grandfather were all dentists in the Texas area. And one thing I just loved about growing up with this example of dentists where their ability to care for patients. Their patients were people that came to our Christmas party, our friends, those that went out to dinner with our family. And so it was just this wonderful community of people that were really grateful for the services they provided. So I knew growing up, I absolutely wanted to help people. And I was told actually by my seventh grade history teacher that I was completely unemployable. So I knew I was going to have to own my own business, which I took as a compliment. I don't think he meant it that way, but I took it as a compliment. So it was the perfect marriage of both dentistry and owning my own private practice that aligned with what I wanted to do. It wasn't until my early 20s that the philosophy of my practice and how I wanted to treat people and how I wanted to educate my patients really came to be. I was a Division I athlete. I played field hockey at St. Louis University. A lot of people don't know field hockey. It's really big in the Northeast. We played it here in Dallas, Texas, but it's basically the positions of soccer with a stick and a ball. Just imagine that. But great sport. I was a Division I field hockey player, ran marathons, was a spin instructor, just completely active. And one day I had a mini stroke and I was driving my car and I wrecked it. No one was hurt, don't worry. But it was a real pivotal moment in my life where I was not healthy. I went from being extremely healthy to not healthy. And I entered into this, maze of trying to figure out what was going on with me and what the solutions were. And unfortunately, long story short, I ended up thinking my only option was a surgical route. And so I had a cardiovascular surgeon who diagnosed a hole in my heart and unfortunately, that first surgery didn't go well. It actually made me more sick than it helped me. So these mini strokes turned into a lot more serious issues. I was told over and over again that it was me being weak, and if I would just push harder, I would heal. And that mentality was so frustrating, especially as someone who was super active in her young 20s to now just being worthless, not wanting to get up in the morning, having no energy, no vibrancy, and quite honestly, no hope for my future. It wasn't until I met a second doctor that was able to correctly diagnose with what was going on, performed immediately an open heart surgery, and fixed it. I woke up feeling helpful, feeling energized. Of course, I was recovering from open heart surgery, so we had that, but immediately the mentality switched. The difference in those two doctors of being told what I needed and being scolded is how it was my interpretation, or being told that I was weak and that's why I wasn't feeling well, versus that second provider who really empowered me to understand what was going on with my body and really empowered me to understand all of my different options, both the pros and the cons of them, that I realized that was the type of provider I wanted to be. So as I became a dentist, I became less of a doctor in a white coat. I wear a black coat actually. I'm in a white coat who tells you what you need and this is what you need. And I really try to emulate that second doctor who provides, yes, I have niche expertise as a dentist. I went to dental school. I have experience in dental issues, but let me share all that expertise with you. Let me empower my patient to understand what their options are. And that way they feel really empowered with what they choose. They don't always take my suggestions, but what's a win for me and what's a win in my office is if we have given them all the options so that when they choose, they truly understand what they're choosing, both the benefits and the potential downsides of that. And that was that is something that I'm so passionate about, compromising about. And that really stems from that first surgery that I had to have where I don't feel like I was empowered. I don't feel like I understand in my options. And part of that's on me for sure. But part of it was also on this doctor that was in such high regard that where I felt like that and I felt inferior in that relationship.
Right. Wow, what a powerful story. That's amazing that it led you to kind of where you are, though.
It did, and I'll tell you just as an aside too. I actually am really proud. I wrote a book a couple years ago. It's called Moms in the Trenches. It tells that
Awesome.
story in a little bit more detail if someone wants to dig in and read more about it. It's a quick read. Don't worry, I'm a dentist. I'm not a writer. It's a quick. My mom told me to make it cute, so it's like pink and turquoise cover in case no one reads it. But I will tell you too. Part of that experience, I was very very angry. I was very angry at that first doctor.
Hmm.
And as much as I blamed him for the negative impacts that I had in my life for that year, where I was really, really sick, I also have to thank him because I am so grateful to him for creating that experience so that I do have this perspective, so that now I have this unwavering commitment to radical generosity and education for my patients. And I'm not sure I would have had that if I didn't have this experience. So I'm not sure I would have been as committed and unwavering to that if I didn't have that experience. So I'm not mad anymore. I'm just extremely grateful for that experience and extremely grateful to him for providing it. Now, could have I learned that lesson maybe in a different way? So, like, let's not go too far, but we've got to turn it around just a little bit. And I, I think because of what I experienced, I think I've and I say this humbly, but I think that I've really helped a lot of patients maybe see that there's a different option to some of the symptoms that they're looking at, that there are different choices and giving them the information rather than being this all-knowing being because I went to dental school. Hey, here's this niche expertise. Let me give it to you. Now what do you think? And really creating more of a servant-hearted and relationship with my patients, which is so key. You have to be more relational than transactional in these relationships. And I think that's what's contributed to the growth of my practice.
I love that. So you're talking about radical generosity. This is one of the things that immediately caught my attention. It's forefront of your website. You talked about it when we booked a call, you brought it up. So in a competitive industry like dentistry and really any industry, it's easy to focus solely on the bottom line. Can you tell us what radical generosity means to you in the context of a dental practice, and then especially one that emphasizes holistic family dentistry and kind of addresses the root causes of disease? What does that radical generosity look like with your
Yeah,
practice?
absolutely. Well, as a child of the '80s, the word radical obviously has a little extra
Yeah.
meaning, right? So they're a little bit of a play on words with that, but radical generosity really just encapsulates what our core values are. I think in this day and age, a true sense of authenticity is kind of missing. And I think that patients are really attracted to someone who does have that authenticity and also is just really willing to help. And so, listen, the authenticity, I am not perfect. My office is not perfect. We have systems to answer the phone, we have systems to schedule patients. There are written systems, we're trained, and still we mess up, right? Sometimes we
Yes.
still don't do it right. But if we can have that authenticity and tell the patient, hey, I'm so sorry. We had the best of intentions and it just didn't work out. And so, as an effort to make this up to you and to rebuild our trust, and then provide a solution that's good for the patients.
Hmm.
So I think, again, having a more relational rather than transactional relationship is really super important. But radical generosity just means going above and beyond in ways that patients would never expect. So this ice storm was a really great example. Our office was closed for 5 days, and I had a husband of a patient. He wasn't a patient here. She was. There was an extreme tooth pain. His dentist wasn't calling him back. So I went and picked him up in our
Wow.
four-wheel car, and we drove him to the office and we took care of him. We went above and beyond. He never expected that to happen. When patients come in and they schedule for a limited exam and this tooth is bothering me, we go above and beyond to provide information about why, hey, maybe it's not just this one tooth. Maybe there's something else going on. Let's dive into how you breathe, how you eat, what you eat, how you sleep, were you breastfed or bottle fed as a child. We dive into this very extensive history so we can truly understand our patients. And I think in a system, both medical and dental, that is really kind of, especially insurance driven when, hey, if you own a business, you got to keep your doors open. And to keep your doors open, if you're insurance driven or an insurance practice, there are certain metrics that you have to hit to be able to pay the bills. I understand that. I don't like the system. I don't subscribe to it, but I understand that's what it is. So for a patient to come into my office and to get 90 minutes of my time and to really get to the root cause of what's happening to them, I think that there is a surprise and that they get so much time and they get so much information that when you do have radical generosity, of course you don't to receive, but when you give to people in that way, it's only human nature to want to give back. And how they give back comes off in lots of different ways, whether it's, homemade sourdough bread that they make me, whether it's telling their friend at lunch how kind Central Dentist was to them, or whether it's just like a peace of mind that they have when they go home and nothing comes of it. It's those opportunities to just over deliver in a way that a patient would never expect and doesn't necessarily get in other offices that I think is unique to Central Dentist and something that does set us apart in a very saturated area of Dallas where, hey, my neighbor's a dentist and the guy across the street's a dentist. There's plenty of opportunities. And by the way, they're great dentists. You can go see both of them. They do great fillings and great crowns, but it is that, radical generosity, knowing that someone is going to be authentic with you and really look at the root causes, what's happening, and try to address that so that all the symptoms go away.
Awesome.
So that.
Yeah, I love that, and I love the radical generosity philosophy. You really take that to a next level, though, because of the resources that you've put together, and the education that you provide your clients. So there were some things on your website I was like, I wanna know what this is. I don't know what this is.
Good. Yay.
So tell us a little bit about you focus some on preventative and biocompatible oral health therapy. So tell us a little bit about what that entails
Yeah.
and kinda how that maybe sets you apart from other dentists in the area.
For sure. And so I use this analogy. No one likes it. Like my team tells me, don't use it. This is bad. My husband's like, please don't do this analogy. But it just makes sense to me. I don't have a lot of knowledge about cars. And so when
Mhm.
I take my car in, not that dentists or mechanics, but hey, this is an example of someone with niche expertise. I take my car into the mechanic and they're like, you should do X, Y, and Z. And I'm like, I just came to get my car filled with gas, right? Like, what do you, and that's a bad example, whatever. You know what I'm saying? So there are niche expertise. There's a reason. I don't believe that a mechanic is trying to rip me off, but I also don't understand the value of the more expensive oil or the value of
Right.
brake pads until my car doesn't stop, right? And so if they can show me or if there's a way to, for me to understand better, thank you for this wisdom. Of course I'm going to choose to service my car's brake pads. I have 4 beautiful children. I don't want to not have brake pads that work.
Yeah.
So I think that similar sense of, hey, I don't really understand what's going on with my teeth. The exam where you're kind of like pointing back here, like, no, I don't see what you're saying, this dark spot. I think that it's a very straightforward, easy, authentic way to show patients what we're talking about by using technology. So we use a digital iTero scanner. We call it our dental health scan. Every patient gets one. There's no radiation. And by the way, it's complimentary. And so we scan every single surface of your mouth and we can take a look at those teeth. There's actually technology built into that scanner that shows changes in demineralization. So if there's a cavity, we see it immediately. We can then take a 3D image, a CBCT, to look at not only the teeth, but we can look at all the bones, of the sinuses, of the airway, everywhere, all over. We then use AI generated second looks. So we can load those x-rays, those digital x-rays, into an AI generated system that points out any irregularities. So by the
Mm.
time I've looked at it, I've taken for my opinion, based off of 20 years of experience and overlay it with the AI and color code it, it becomes quite apparent for patients. Oh, what's that? Oh, I need to fix this. So patients are asking more for solutions than me telling them what's wrong with them. And I think that's really empowering. If you see a tooth that has a big fracture line in it and it's in the very, very back, but you can't see it when you're brushing your teeth or when I have my like little weird mirror and I'm like stretching your cheek, when they see it on the screen, it makes sense. And so part of running a successful dental practice is case closures. What's your percentage of closing cases? What's your percentage of unscheduled production? How can we get these production numbers up, right? Production leads to collections. Collections lead to money and having your doors stay open. So if we can treat it more as an opportunity to educate our patients, hey, you have this huge cracked tooth. It's not me just telling you that. Look at this picture. Look at this scan. I think we need to put a crown on that tooth. If you do, it'll protect it. If you don't, it could break. And then we have to take the tooth out and maybe do an implant, which is more expensive and more invasive. It really allows and by the way, I don't care what you do. You can leave it if you want. And if it cracks, I'll be here to help you with the implant. But the most conservative way to do this, the most proactive way to treat this is to put a crown on. And by the way, would you like to do that today? Be so happy. I know you took off work. I know you traveled to get here. We can take care of that today. It's just being so generous with information that we're sharing, generous with opportunities to fix it, has really resonated well in my office. And so unscheduled treatment isn't something that we schedule with. Case closures isn't something we schedule with because we struggle with, because rather than me telling you what you need to do, we're showing you the conditions that exist. we're offering solutions to provide it. So we're on the same team. So we build high trust with our patients very early on because we're on the same team. Hey, I just want you to keep your teeth. I want you to have a beautiful smile. I also want you to minimize the amount of times you come to the office. I'd love for you to show up and get your teeth clean, and let's talk about the weather and the Dallas Cowboys being terrible, right? I'd love for them to be in our healthy, boring category. People hate the dentist because every time they go in, it's something they need something else and it's more expensive or more invasive. So if we can be more proactive, if I can make the investment in the technology that allows us to be on the same team to see what the problems are and create solutions together, it really builds that high level of trust with patients. And then, by the way, when I first started practicing, I'm super competitive. I told you about my athletic background.
Mm-hmm.
And I take a lot of pride in my dentistry. I have the privilege of seeing patients even from my great grandfather. Just a side note, I just saw one of his patients recently, this
Wow.
105-year-old lady, feisty as can be. I mean, she is just fight. I just love her. But the really cool thing is some of the dentistry in her mouth is the dentistry that my grandfather did 50, 60 years ago.
And she
So, like,
still has her teeth.
and she still has her teeth, which is incredible, right? That's the goal.
Yeah.
So, like, we talk about as I'm entering the second half of my life, which I'm very proud to, to be doing that. As we talk about what your legacy is, how brilliant would it be that if my legacy is that I provided radical generosity for patients and then also just amazing badass dentistry that they had in their mouth well into their hundreds, right? And so when I started doing dentistry early out of practice and I would do the filling and I'd work so hard on it and my OCD would kick in and they'd come back 6 months later and it was broken, I'd be really mad. Like, what do you
Yeah.
mean it's broken? You're brushing, you're flossing, you're eating right? Like, what do you mean? And so really diving into those deep, what the root causes are. Oh, well, you're grinding your teeth at night because you're breathing through your mouth, or you're grinding your teeth because you have a major parasite infestation, that you need to do a parasite cleanse. Like, there's so many other opportunities. So it created this. One of my core values is being very solutions oriented and very dynamic. So just when I've figured something out, someone else walks in my door and really puts the pressure on me to go find other solutions. What else could be going on with this? So very early on in my career, it wasn't just, sorry, the filling break, let's do a crown. It was, why did the filling grow? Let's dig deeper, dig deeper, dig deeper, treat that root cause. And then guess what? You don't even need the filling. We figured out why the pH of your saliva is acidic and that's causing the wearing down of your teeth. Here's what we'll do to fix that. By the way, that's a very simple solution. And then you never even have to come get fillings, or you won't have cavities or demineralization. So I think, part of that commitment of radical generosity and being dynamic and solutions oriented and not having an ego, looking at every single patient with a clean slate. Yes, of course, using my experience, but looking at every patient with what their behavior is can really attribute to that high level of trust with patients. And then when we have the technology and the pictures to support that, patients are very, very appreciative.
I love that. That's a great story all around.
Thank you.
Um, So your practice offers a lot of education. A lot of it's on your website, and it
Yes.
sounds like you take opportunities out of challenges to go out and find new solutions because you are so solution and outcome oriented, which I love. I'm super passionate about focusing on outcomes and
Right.
effectively reaching solutions. So tell us a little bit about some of the preventative care that you do, the early intervention programs that are rooted in optimal nutrition, hygiene, oral habits, and supplementation for disease prevention.
Yeah, for sure. Thank you for bringing that up because I will just say this, with the ice that just happened, we were shut. We didn't see patients for a few days. I did over 50 hours of CE, just of different courses where I'm trying to learn something different. Some of it was new, some of it was reminder, some of it I've never heard before, and I signed up for more courses. So it's that consistency and dedication to education, being very humble. Hey, I'm really smart, but I don't know it all. And I do want to know it all though. So that kind of, has that thirst to do that. And it's difficult. It can be hard to be the expert in everything. So surrounding myself with people that are the experts so I can, pick and choose from what they're doing is really great. But what I found is, as I joined my father's practice when I graduated dental school, I'm like, ta-da, dad, I'm here. I actually moved to Alaska first and did some public health dentistry, and
Wow.
it was super cold. So then I showed up and was like, ta-da, I'm here a year early together. And of course he wasn't prepared for that. He thought I was going to be freezing my little tail off up in Alaska. We were treating, as a fourth generation dentist, we were treating our patients, our family of patients, as they got older. And so I was seeing some of my grandfather's patients. I was seeing even some of my dad's patients that had now, their life circumstances had changed and they were in a nursing home. So going and providing on-site dental care for patients who couldn't travel to a traditional dental office was something we felt really passionate about because we wanted to continue to serve these patients. But walking into these nursing homes was just very jarring. The posture, and that's to say, these homes are lovely and they take really great care of people, and they're necessary for a lot of people. But it was jarring in that I don't want to have dementia. I don't want to
Yeah.
be in a wheelchair. I don't want to. The thought of losing my mind is like the scariest thing to me. Now, my 4 children might say I've already lost my mind, but that's intentional. So, I think that really scares me. The thought of, having cancer. I want to do everything I can so that not only am I a very active grandmother, but I'm an active great grandmother that's like on the floor with my great grandchildren playing. Like, how lovely does that sound? Telling them stories about my childhood. So as I was so proud to help these patients in the nursing home, I was also equally motivated. Hey, there has to be something on the other side of this that gets us where this is not our ending. And that really starts, almost in utero, the toxins that you are exposed to while your mother's pregnant. And as you are born, what you're exposed to, the food that you eat, having whole food, non-toxic food that's grown in nice clean soil, right? That
Hmm.
doesn't have pesticides and fertilizers on it. And through your nose, allowing your body to get proper oxygenation so that you can cycle through all the sleep cycles and get that regenerative detox deep sleep that our bodies need from living in our beautiful lives all day. Drinking nice clean water, right? Breathing clean air. And all of those things are so important. And then also just joy, living a life that you love. All of those things, if we can align all of those pillars of faith, it leads you on a healthier outcome. Now, the more I dove into that, the more scared I got because it's tough to get really clean food. And by the way, it's really super expensive. It's
Hmm.
way easier for me to feed my family of 6 if we drive through the McDonald's drive-through and get value meals than it is to go to Whole Foods and get clean food that we can prepare at home. Water is also tricky to get. And then clean air is tricky to get, right? I live in Dallas with the pollutants and the toxins and all the things. So really being intentional about what we put on our bodies and how we do that is important. So we talk about that. We talk about that as new patients. What are we eating? What works for you? I like to say everything in moderation, including moderation. We can't always be clean. We can't always eat, food. Don't worry, my kids get a burger every now and then, right? We're pulling through Chick-fil-A every now and then. But and most of the time, if we can really put whole clean foods and breathe whole clean air, not be exposed to mold, et cetera, that's just going to make us the best version of ourselves. And so we talk about that here in my office, even as early. I had a 2-week-old in my office last week that had a lip and tongue tie and wasn't able to breastfeed. And the mom was just so motivated to make that work. And so we used a BioLace laser and released that. Mom was able to immediately breastfeed. And that just really changes the course of that child's life. That mom is a saint, right? Like it was hurting her and she just knew in her gut that something could be better. Like that's what was so great. So now that ability to breastfeed and develop the upper and lower arch and open that airway so the child can breathe through the nose completely changes the course of that child's life versus not having those released. I find that I know when I was growing up and even now as I'm in my mid 40s, mom of 4. We almost wear like busy as a badge of honor. Like, look how busy I am.
Hmm.
And I think that that's just really dangerous because what I would love to wear as a badge of honor is like, look, I cycled through the REM sleep 4 times last night. Like, look, I'm properly hydrated. I had, 100 ounces of water. I wish we could like shift our focus of what we thought was super important because sleep is so important. Getting all the laundry done, everything monogrammed is so cute and wonderful, but like also for me, not realistic. So accepting that so that I can allow my body to rest. And we're finding, generationally, there's lots of factors, but generationally, environmentally, there are changes in how our faces are adapting. So kids up until the onset of puberty, which I'll just call 12, it can be different for everybody. Kids, their bones and their jaws are like Play-Doh. We can actually manipulate them. We can promote the growth. We can open the airway. We can retrain the tongue so that it functions the way it's supposed to. And we can build a whole team of players that can help us with that. One thing we do here at Central Dentist, we use early intervention appliances that use the pressure of the teeth and the tongue to get that. We partner with myofunctional therapists who help really exercise the tongue so that the tongue can do that. We partner with chiropractors that get alignment of the spine to help the tongue
Wow.
function properly. So building that is probably what I am most proud of in my career is building a team of like-minded providers who are just so focused on these children getting the right tools so that their bodies can grow and develop the way they're supposed to and set them up from success very early. The problem is that, for example, if they have an underdeveloped jaw, their tongue pushes back into their airway. When they go to sleep at night, that airway, which is like a tube, we want it to be the size of like a garden hose. Some kids have like the size of a coffee straw. we want to keep that open so we get plenty of air. If that tongue falls back into the airway, the body's so healthy, it reacts. I need more air. And that's a sympathetic reaction. So that's driven by cortisol, which is a fight or flight. We all know we've got to decrease that cortisol, decrease the inflammation, and prevent sleep disturbances. And so lots of different ways that we can do that. But we really want to address it early when they're still kind of that Play-Doh, because by the time they're an adult, if they're concrete, right? Those bones are concrete. And if their tongue is falling back in the airway, one way that they could potentially compensate is by grinding their teeth. Well, guess what? They come in with a broken tooth. Well, we'll fix that tooth. They keep grinding because we didn't address the root cause, and they break the filling, and now they need a crown. And here's why they hate the dentist, because they get put on this merry-go-round. Whereas if we address that root cause and help open their airway through lots of different methods, depending on what aligns with what their overall health goals are, guess what? We do that filling, we treat the root cause, and that's all that they need. And so I think that patients are really great to understand my body is super strong. That's why I'm able to compensate if I'm not getting enough oxygen, I'm not getting restful sleep. But enough is enough. Sleep is so important. How can I get that proper oxygenation? What can I do so that my body can heal and detox the way it's supposed to?
That's awesome. It's great that you focus so much on sleep because it's becoming more known, but it's still not focused on enough. And I love your idea of having a badge for
I know.
moms
Yeah.
because
That's
I've
like,
become like I use my Garmin watch
yeah.
to track all of my sleep, and I've become so like focused on, okay, I got to make sure I hit all my cycles, like
Yes.
got to get that deep sleep up, all of those things. And it's like it's hard. You have to like really work at it and try different things and see how different things affect your sleep.
Yeah. Well, I think that's some like the beauty of industry is how technology, I mean, now when we're talking about AI and technology with my children, it's a very different conversation because I've already learned how to think for myself. Had, a long time to do that. And now with my children, they have to learn to think for themselves and then use it as a tool. But one thing that I love about technology is that it's really putting the information in the hands of the consumer. So if you wanted your sleep evaluated, maybe 10 years ago, I might be a little off with that, but let's say 10 years ago, you would have to get what's called a polysomnogram, which puts you in a hospital with all these
Hmm.
electrodes on your head, several $1,000s. Like, I don't even sleep well in a nice hotel, let alone in a hospital when I know you're watching me. Creepy. I don't love it. Right. So fast forward, a decade or how many years. And now, you can put a ring on that tells
Hmm.
you just as much information. You can put like there's so much new technology that's coming out that's just incredible. So for someone, yes, a Garmin watch, an Apple Watch, for someone to have access to that information, and then what's even crazier is now patients are taking that and like cut and pasting it into ChatGPT. I don't always recommend that, but they're getting solutions of, oh, there is something that I can do. My lab work looks normal, but I don't feel good. So what does this mean? So patients are becoming smarter and smarter. They're becoming more empowered with information. And the part that I love the most about patients is that they're less willing to accept the circumstances. They want what's best. They want to optimize. They want to be the best version of themselves. They want to show up every day as the best version of themselves. And that is my favorite patient. The one who's just like, give me everything. What can I do to get better? What can I do to be better? That's my other favorite is the one that's hopeless because I'm like, here's what you can do to be better. I love them all, but someone who's just really eager to be the best version of themselves that comes in equipped. It's really fun to get to talk about solutions again that kind of align with what their overall goals are.
That's awesome. I just love it. I think it's so important in the holistic approach. So,
Yes. And I
um,
think there's also, I think there's still such an opportunity. I don't know if this is going to happen in my lifetime or if it'll happen after, but I think there's such an opportunity for medical doctors and dentists to work together because there are so many patients that we see that I really put on my like holistic lens to look at them that are having systemic issues that really originate in the mouth. And so the mouth is the gateway for the whole body. And so we have, I mean, I could tell you story after story about, a patient that had a hip issue. And really it was because they had malocclusion. Their teeth were so malaligned that the forces were so inappropriate. It was causing issues all the way down to the chain.
wow.
So rather than having a hip replacement, we use clear aligners to line their smile. And guess what? Their hip improved. Right. We've
Wow.
had patients that have infected, abscessed, non healed root canals that have issues systemically. And they've done everything they can. They have that infected tooth coming out. And then guess what? Their systemic body issue has resolved because we removed that infection. All I do know is the body is so magical and the body's ability to heal itself is so magical. We just have to get out of its way a little bit and kind of reset factory settings, so to speak, and let it do its work. And I just think that there's such an opportunity for dentists and medical doctors to look at the holistic body, the whole person,
Hmm.
rather than as our specialties to divide everything up. It's weird to me that there's like someone that just looks at your eyes and like someone that just looks at your ears and like it's bizarre. Like, how are we not looking at the whole thing? And that, to be fair, I think that goes back to insurance driven practice. And hey, by the way, that guy doesn't have time to look at your whole body. He barely has time to look at your eyeball, right? Like, he
Right.
barely has time to look at your knee to figure out what things are going on. So I think it needs kind of a reworking of the whole system for patients to be able to benefit from that. But the good news is while I'm not optimistic that the system is going to redo itself, I am so optimistic in patients being disruptors and demanding that for themselves. Hey, I demand a whole body solution to this. And really, when it comes from the patients, when they're driving it, it leaves either you get on board or you get out of the way. So I think it's going to be really exciting when this big change happens to how we treat our bodies and how we approach it.
That's great. Yeah, I would love to see a change like that. I've always thought there needs to be like some master of ceremonies that is, kind of organizing all of these different specialists so that we
Yeah.
have a
Do
really,
it. I
yeah.
just need a baton. I'll be happy to do it. Dee, 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 dee.
And you
I'll
do a
really show
lot.
my seventh grade history teacher. Do, do, do.
Yeah, you'll show them.
I'll show him. It's funny because he actually still teaches at the school that I went to
Really?
where my daughters now go. And I like to bring this up to him all the time. And he's like, I meant it as a compliment. I'm like, no, you didn't. I took it as a compliment, but it's
That's
pretty
so
funny.
great. I'm glad that you kid him about it. So
Oh,
that's
of
great. He
course. Oh,
needs
he
it.
totally deserves that. Who says that to a child? That
I
is like,
know.
I
Surely
know.
he learned his lesson though. Surely
I don't know. I don't
he
know.
has learned
He
his
told my
lesson.
daughter something similar. And I was like, oh, you just tell him thank you.
It's all you're amazing at that perspective shift. Like you
Yes.
take it and you're like, actually, I'm going to shift my perspective on that, which
Yes.
is, I think,
Yes.
led you to where you are. It's
Yeah.
a testament to you as a person and a competitor. So that's
Thank you.
awesome. So you do tackle a lot of chronic inflammatory symptoms and chronic pain, and you focus on collaborating with other health and wellness providers. Talk about, I know you talked a little bit about this comprehensive approach, but kind of talk about what you're currently doing and then I know kind of your optimal, this is our ideal, we all collaborate together, but what are you currently doing to collaborate and which types of physicians or specialists do you collaborate with?
Yeah, great question. I love to talk about this. So, when we intake a new patient, that appointment takes about 90 minutes. We're really exploring a lot of things. Part of that intake really talks about what the patient's goals are, and so what's most important to them. Yes, I can tell you if I go back to that stupid, auto parts store example, I can tell you
Hmm.
everything you need on your car. But what's the most important thing? If you ask me, I'd say I don't want to crash. I want my brakes to work, and I want like a great playlist on my speakers. So I want my speakers to work. Like those are my two priorities. So if you start talking about like changing the leather seats, don't care, right? If you start talking about like gas mileage, actually don't actually care, right? Like, can I hear my playlist and am I going to be able to stop my car? So using that same silly analogy, I want to align with what the patient's goals are. So if their goal is, I really want to improve digestion, I really want to be able to poop twice a day. I really want to be able to use my food for energy. Okay, cool. How can I impact that? We know we look at it from microbiome perspective.
Hmm.
So like, what is the bacteria in your mouth? We know digestion starts in the mouth. How many teeth do you have to chew your food? Right. So how well do you chew your food? So if that's what's going to help, I'm not going to, start talking to him about removing silver fillings, even though they have mercury on them. He'd be better off. It'll prevent his ability, or it'll decrease his tendency to get dementia without those silver fillings. Hey, that's not really his goal. He's not really talking about not getting dementia. He's talking about digesting that food. So we're able to hear everything and then really be strategic about what that phase one looks like. Your most important thing is digesting your food. Here's what we can do. We've got to reset the microbiome. So we're going to do a deeper cleaning. We're going to use lasers. We're going to use ozone gas to reset that microbiome. And then, by the way, your mouth is completely, or we say your mouth is completely healthy. We've really got to change what that leaky gut looks like. Go see this functional nutritionist. She's going to talk you through. She's going to do a diary of your diet for a few days. She's going to talk you through what low and high inflammatory foods are. She's going to, and then come back and we'll reevaluate what that mouth looks like once you've made these dietary changes in 90 days, because we know that communicates together. We'll talk to some patients that say, I'm on antibiotics all the time because I always have these sinus infections and they're chronic mouth breathers. We take that 3D CBCT to look at the sinuses, to look at that airway and say, hey, you're a mouth breather because your airway is so small. Let's open up that airway so you have potential to breathe through your nose, and let's see if that inflammation goes away. And so rather than having sinus surgery, why don't we try this first? And we recommend different products, all natural, holistic products. I will say another part of that radical generosity is this is not proprietary. This is not information that I'm holding to myself. It's all on my website. Go to
Hmm.
centraldentist.com. Recommended products, they're all listed there with an explanation of how to use them. You click it, it loads it in your Amazon basket, or it takes you directly to their site. I'm not looking to sell products. I didn't invent any of those products, right? So those products do change every now and then. If I find something better, or if the ingredients change, I update that frequently, actually. And so sharing that information could be really helpful. We have a mom that comes with a baby that needs tongue releases. Hey, we've got to work with that myofunctional therapist. You have to see them first. We have to build up some muscle memory, get proper function, learn the stretches. I'll do my piece of releasing the tongue, and then you're going to see that myofunctional therapist afterwards to make sure that this treatment was successful. So I work with everyone from functional neurologists, so patients that have overall systemic inflammation, have difficulty, have POTS or something like that, that they're just not functioning to their optimal ideal. I see a lot of patients, a lot of parents of children who have symptoms of ADD, ADHD, but aren't eager to go on medication. And so we do as much behavior modification as we can. Some of those kids do need medication, but if we can decrease the amount, if we can lessen it because we made other changes, that can be a win in our office. Evaluating sleep, getting them with a functional neurologist that teaches them different practices, different eye movements that program different parts of the brain, different detox abilities, detox pathways, opening up their detox pathways can be really important as well.
Very cool. So I want to talk a little bit about your business practices, but before we do, I have a side question. So
Sure.
I started using a nano hydroxy paste. Is that a thing?
Yeah. Yes.
Okay.
Anti-hydroxyapatite.
Yeah. What are your thoughts on that?
Yes. So I have so many thoughts about it,
Okay.
actually. So if we think about our teeth,
Uh-huh.
this is a great analogy. This is better than my auto parts
No
store.
way. It can't be better.
Like, you thought I peaked with that. Here we go. Here's an even better one. I thought of this when I was pregnant with my fourth because I ate so many peanut M&Ms that I'm like, this makes perfect sense. If you imagine your tooth is like a peanut M&M, bear with me, Nancy. It's going somewhere. Not anywhere quick, but it's going somewhere. We have the candy coated shell, the chocolate, and the peanut. So that candy coated shell is like your enamel. Every time you eat something, drink something, or the way you breathe, it changes the pH of that saliva. So the more acidic your saliva, the more likely it is to kind of break that down. The more basic the saliva, it remineralizes it and makes it strong again. Once that demineralization gets into the chocolate of your tooth, the dentin, that's truly a cavity. We need to go remove that disease process and seal it up with a biocompatible filling. Once it gets to the peanut, well, that's a root canal or an extraction, et cetera, because we have to take that peanut out with the whole tooth. So it makes sense to me if I'm kind of assaulting this candy coated shell every single day with what I eat, it makes sense to me. Why wouldn't I take the same mineral that it's made out of and put it on there, let the tooth soak it in to make it nice and strong? So a more traditional approach is to use fluoride. And so you would put the fluoride on the teeth. There have been lots of studies that have been done for a long time. They're recently being released that show that fluoride can be a neurotoxin. So is fluoride safe for most children? Probably, right? But if we have a toxic bucket in our life and they have fluoride and they have McDonald's and they have this toxin and they live in
Right.
mold, it's just one more thing that kind of fills their toxic bucket. And so I think, the fluoride conversation gets discredited very quickly because most kids are okay and it's not going to be life or death, right? Some people can smoke cigarettes and not get lung cancer, right? Lots of people can use fluoride and not have brain damage. But as we're looking at that toxic bucket, sometimes it can cause it to overflow. Why add one more thing is how I look at it. So what the outer layer of that tooth is made out of is hydroxyapatite. So a more natural toothpaste actually has hydroxyapatite, and then the nanohydroxyapatite, which is even smaller, so it can be absorbed by those teeth to strengthen the outer from the damage that we do by living our lives every day. So that's what's in my drawer. That's what I use.
Okay.
It makes sense to me. But, that's not to say if all I have available is a fluoride toothpaste, I'm just like not going to brush my teeth that day. But I recognize, hey, I'm adding this toxin to my toxic bucket. What can I do to help detox from that and make intentional choices to try to be the least toxic version of myself?
Okay. Wonderful answer. Very helpful. Thank
Oh,
you.
well,
Because
thank you. And
sometimes I
actually,
start using products because I read some stuff and then I'm like, I hope this is the right thing I'm doing.
totally. And that's what's so dangerous about Instagram, especially like in the holistic space, is these people used to just be like servant hearted and just good people like spreading information. And now it's like big business. Like I've had several, functional chiropractors that I used to refer patients to that they're no longer practicing. They just do Instagram full time. And I think that they're good people, but everybody has a price. And so if we're going to push a product because it's going to make X amount of dollars, like I hope that people aren't, tempted, but I mean, it would be it'd be a hard no
Right.
if you could get behind a product. So I think you're right, but that is a good choice. And actually an interesting story, when we see kiddos, especially adults as well, that have these demineralizations, that shows up in our technology, whether it's all the way into the chocolate or just in the candy coated shell. I probably took that analogy too far. So thanks for sticking with me
That's
on that.
great.
But
I love it.
if it's just in the candy coated shell, we actually empower the patient to heal it on their own. And so if we can identify the root cause as to why they have that demineralization, kind of falls in two categories that oral hygiene and diet. All right, 10-year-old boy, you need to brush your teeth and not eat, candy in bed. Cool, we can behavior modification. But if patients are brushing and flossing and eating correctly and they're still having these demineralizations, we kind of flip the coin on it. We're like, is there an increased susceptibility? Are you mouth breathing? Do you have super high cortisol at work? Or life? Do you have, what else is going on that we can address to keep that nice and basic? And there's different toothpaste that have different levels of hydroxyapatite in them. So on my website, for example, there's some that are like $7 to $10, and that has a great percentage of hydroxyapatite to be used every day, kind of a maintenance. But then there's also some that have a very high percentage of hydroxyapatite, like 38, 40%. Of course, that one's more expensive. It's closer to $20, $25. But the investment is worth it if it can potentially go in and heal those cavities and those demineralizations so that you don't have to do a filling. Again, I do beautiful fillings. I love them. I'm super OCD, undiagnosed, but I'm like taking advantage of it at work. But nothing is as good as your natural tooth. So if there's an opportunity for a child or an adult to use this toothpaste, yes, it's an investment at 20, $25, but that's way less of an investment than a filling and taking off work to come get the filling and having disease in your tooth. So a lot of our patients have just been really grateful for that option and really super dedicated to doing it. And we see those remineralize all the time. It's like the most fun day at work when patients heal themselves.
I love that. You were talking about fillings. So tell me, because you said earlier, I think you said biomatched or bioidentical
Yeah.
fillings.
Yeah.
How are your fillings different than a traditional dentist fillings?
Yeah,
Or
so they can be. So it just depends. But I think if I were to nerd out on anything, well, I'm nerdy about a lot of things, but the types of fillings that we put in in our mouth are so important because the saliva is introduced to the body, right? If you really want to go like Eastern medicine, they talk about how each tooth has a meridian, has a corresponding organ in your body. So like this tooth corresponds to your right breast, the front teeth correspond to your thyroid. It's so interesting if you want to do a deep dive kind of in Eastern medicine. And by the way, there's a place for Eastern and Western medicine. The solution's usually in between. But yes, I'm obsessed with the materials that we put in. So, my grandfather, God bless him, when he practiced, he didn't even wear gloves, right? They didn't start wearing gloves till my dad started practicing in the 80s, and he would use mercury fillings. It was so excited. We didn't have to pull all these teeth. He could actually put a filling in. So he didn't have a glove, and he would rub the mercury filling. That was like standard of care, by the way, and put it in the tooth. And his mercury fillings are gorgeous, but they're full of mercury and
yeah.
they're metal. And so we know that they contract and shrink every time they get hot or cold. And
Hmm.
so they can crack and they release mercury into the gut and into the brain, and they lead to heavy metal toxicity, especially with all the other heavy metals we have in our lives. So we have to make sure that any biocompatible material that we place in the mouth is inert, which means it doesn't react. It's not going to expand and contract like those fillings. And the body is not going to recognize it as a foreign agent. So even some of these metal implants, I mean, implant technology is so incredible. It's come so far. And they've used titanium, which works for most people, some people. But some people have a reaction to that metal. And so, yes, we give them an implant, but they just have this consistent inflammatory reaction that their immune system constantly has to react to. So it makes more sense to me to use a ceramic implant because that's biocompatible. The body will recognize it as being on its own. Rather than using a bone graft, there's like amazing bone grafts out there that are natural and, full of stem cell, all kinds of things. It makes more sense to me to pull someone's blood out, spin it down, get the platelet-rich fibrin, which is full of their own stem cells, their own platelets, and put that in there. So then the implant gets to go with your own self. Nothing is as good as yourself, right?
Right.
So that makes more sense. So yes, we are just obsessed with putting materials in the mouth. And by the way, some of these patients are hyperreactive because they do have a lot of inflammation. So we partner with, a doctor who can do biocompatibility testing. Hey, I think these are the best materials, but do they work for you? Because you have, a long-term history of Epstein-Barr and Lyme disease and cancer and these things. And so we can actually know ahead of time if these materials work. Hey, these work for 90% of people, but are you 90% of people? Or are you that 10% exception? Let's get more information. And patients can be just feel more confident about taking that next step if they know, okay, this will work with my body. Same thing when we're doing fillings. We don't, and some of them, if we're all the way down to the peanut or deep into the chocolate, we use surgical hand pieces that, makes that sound that everybody loves. Or, but
Yeah.
if it's, yeah, that's a joke. No one likes that sound.
Yay.
But if it's smaller, we can actually use a laser. We use a hard tissue laser.
Wow.
Patients hate the shot and they hate pain. And sometimes they hate my jokes, but I stand by my jokes. They are cheesy, but they are fantastic. So
So good.
I do not subscribe to hating my jokes, but the pain in the shot, I totally get. So if we can save them the shot and save them the pain by using this hard tissue laser, it makes an unpleasant experience not as bad.
Right. That's great. One more product question before we move on to
Yeah,
business.
please.
So you talked about on your website the ozone treatment, and you talked a little bit here. So I know there's a way to apply with a gas, but there are also options to do, I think, like an oil or a paste or something.
Yeah.
Do
Yeah,
you
for sure.
have that listed on your website as well?
I
Like if
do.
someone wanted to do an at-home treatment that's not in your area or
Yes, for sure. And there's always such confusion around ozone because they think it's like what we're putting a hole in the earth or whatever. Someone had an opportunity to rebrand and they just missed that opportunity. They're like, no, we'll call it ozone. Like, what could go wrong? Right. That ozone that we're referring to is supercharged oxygen. And so that supercharged oxygen is all natural, but it's very reactive. And so that extra oxygen molecule is looking for virus, mold, bacteria, inflammation, and it binds to it and then your body naturally eliminates it. So for the mouth application, you would eliminate it through your mouth. You would breathe out any inflammation that's there. So when you're here in our office, every patient that has a hygiene visit, we do an ozone gas application. Every filling that we do, we remove the demineralization, the cavity, we use ozone gas, and the ozone gas goes through all the tubules of the teeth to clean it all out and calm it all down. Every extraction, if we take out a infected tooth, gets ozone to help heal it, just really helps with the healing. But since you asked about ozone application, yes, there's so many different ways that you can use it. The gas is super reactive, so you kind of have to be in office or have an ozone machine to do it. You can but you can stabilize that ozone by putting it in oil. So on my website, I do have linked an ozone oil by Longevity. It's a brand that I trust. You can get coconut oil, olive oil, sunflower oil, doesn't matter, whatever you want. It's all the same, just whatever. It tastes very healthy, as my daughter would say. But you can rub that on, if you have chapped lips, if you have gingivitis, if you want to make your teeth look whiter, make your gums look healthier. And that's the cheapest way to make your teeth look whiter. We put it on mosquito bites.
oh,
There's
wow.
all different kinds of things. If children have ear infections, ozone can be used rather than antibiotics to clean that up. If you have stuffiness in your nose, you can do nasal ozone. They pretty much, you can put ozone anywhere, and it can help ozone pills, etc. There's ozone treatments where they actually pull your blood, ozonate it, and put it back in your body for patients that have
Wow.
cancer. And a lot of patients during COVID were doing ozone treatments to keep themselves nice and healthy.
That's awesome.
It's
I'm
really
glad I
cool.
asked. All right.
Yes, I am too. It's a very inexpensive way to help your body heal, which is lovely.
Very cool. All
Yeah,
right, let's shift and talk a little bit about business before we sign off here. So, to manage a practice that integrates so many aspects of health, you have to have robust systems. What are some non negotiable systems or approaches that Central Dentist relies on to deliver this level of comprehensive and generous care?
for sure. So I think my biggest struggle in owning this business for 20 years is clinical duplication, right? Because I wanted to build a business. I wanted to live a life where I helped people. And I wanted to live a life where I helped as many people as possible. So in my early stages of my career, I actually traveled all over and lectured talking about sleep disordered breathing in children and would talk to doctors about that. I've been everywhere from Hong Kong, all over Canada, Europe, South America, all over the US. And that's how I was going to spread. And that was difficult because there was, when they had follow-up questions, I wasn't really available for it. So that was a difficult model. So then I redefined what the world was and let me help my patients here. And it got to where I became very unhealthy. Like I was working nonstop. I had these 4 beautiful children. I never miss a soccer game. I never miss a spelling word. I mean, I miss them. I don't know how to spell them, but I'm there helping them practice, right? So let's clarify. But I just ran myself ragged. The whole like burn the candle at both, it would just
Yeah.
apply completely. And so I had to figure out how to have clinical duplication so that any patient that comes to Central Dentist, whether they meet me or one of my 2 associates, they will have the exact same experience and they will get the same level of education, the same level of care. And so I have failed at this I mean, I have just been so terrible at this so many ways, but I do have a good takeaway. I would see all the new patients and I would educate all of them. I tried, here's a written form for you. Ultimately, what I found was very successful, or what has been most successful, is to be non negotiable about the vision of my practice, which is radical generosity. If you're not going to be radically generous, this isn't the place for you. And hey, by the way, I told you there's a dentist across the street. That may be, I mean, maybe he's generous too. I'm not downplaying him, but like, hey, there's another there's no shortage of dentists for you to work with. That's not the vision of the practice. My core values, being dynamic, being ethical, being servant hearted, results oriented, being excellent, and also being fun, those are non negotiables. So if you're going to show up and be a big stick in the mud, like you can't work here because I'm here a lot and like I like to laugh and smile and make jokes. And so you have to also, if you are like so stuck in your ways as an associate dentist and you know everything and it's your ego, hey, that's so great. I'm so proud for you. But like, I'm not. I am, always looking for a different way to do something. I'm always looking for a better solution. I'm always listening to my patients. And so I need someone to match that energy. And what's really interesting is when I've now built a team who shares the vision of the practice and matches core values. And that really takes away a lot of the stress of what these written processes are. Of course, we have a written process. This is how we answer the phone. This is how we schedule. These are our production goals. This is how we collect money. This is how we talk about money with patients.
Hmm.
But really, rather than trying to build robots, which is what I did for the first decade of my career, this is what you say, this is how you say it. I really tried to partner with like-minded people who share this vision and get really excited about being radically generous, and who get really excited about being fun at work and results oriented. They get really excited when a cavity heals. And guess what? We get to delete that filling off their treatment plan. Well, that decreases production, but it worked. So, right. So like that's what we're celebrating and patients see that. So I think that is absolutely the non-negotiable in my practice. And I found that a lot of other systems fall into place. And less do I need to create a script on how to answer the phone. I hire people. I want them to be exactly who they are. And as long as they match our core values, they get to have their own personality. So there's a lot of job satisfaction there because I don't have expectation. Please be exactly who you are. By the way, we make a lot of mistakes around here, but we're authentic about it. And when we correct it, when we make a mistake. Hey, I'm so sorry I didn't call you back, but I'm calling you now and you have my undivided attention. How can I help you? And so patients like to hear that. They don't want perfect people. They want authentic people who will show up and with a strong desire to help them.
Awesome. That's great. So time and resources are always tight in any practice. What is the biggest operational bottleneck that you currently face, whether it's patient scheduling, team empowerment, coordinating with other providers? What takes the most time away from your core mission of radical generosity and patient care?
Yeah, I would just say the influx of new patients. I have this, like I said, very servant-hearted approach to things. I want to help as many as I can, and I realize we can't. We have to set limits, and if that means that we can only see X amount of new patients per month, and the next set of patients will have to wait till the next month, keeping our promise to people, talking with them for 90 minutes, and keeping that promise rather than saying, "Oh, we got 10 more new patients." We figured out what that number was, and we're real strict. So it's difficult to say no. I'm not great at boundaries. I'm not great at saying no. I'm kind of a people pleaser. So I have really strong people in place that I'm so sorry. We don't have any new patient appointments available this month, but Dr. Jill or one of our associates is so excited to get to meet you next month. Should we have a cancellation sooner, we'd be happy to call you and offer that to you. And that way, not only are we keeping our promise to patients that we have, but we're able to provide the level of care that they deserve and that we want to offer without compromising because we have all these other new patients that we're also trying. And then people just get mad because they feel forgotten or falling through the cracks. So we've figured out what that number is and we stick with that. But I would say new patients is the hardest because there's so many hours in the day and establishing a balance both in office and at home, both for me and my associates and all of my team members is super important. So sometimes it puts us in a position where we have to say no. And the no, once they become part of our dental family, they understand and they're so appreciative that we create those boundaries because now they're benefiting from it. But that can be difficult in the beginning for sure.
Yeah, that makes sense. Looking forward, what are the most significant trends or opportunities you see coming in the holistic dental care and community wellness
For sure. I mean,
area?
technology is moving faster than I think
Mhm.
any of us can keep up with. I think, I'm a small business owner. I love employing team members. I love the idea of someone working here and doing good for people and then taking that money and spending it on their family. And I love creating that opportunity for other people. So I struggle because the other part of that is a lot of jobs in the next 5 years are going to be replaced by AI. they're going to be replaced, and the AI is going to do it quicker, faster, cheaper, and more efficiently, and probably smarter. And so I think it's really going to be, gosh, what's the word I could use? I could say scary, exciting, intimidating, like all of these emotions. It's going to be like the wild west of dentistry.
Hmm.
How do we handle this? How do we handle this AI being so smart and moving so fast? And how do we handle maintaining our teams so that people can keep their jobs and help their families? But also, how do we keep up with educating patients? Because if you have AI telling them, they all of a sudden are going to become the authority. So now we're like fighting with AI if it's a different information. So I really think, as much as technology is going to help us, I think we have to get kind of a grip around how we're using it so that we can still, be small business owners that employ people who support their families, that are,
Yeah.
just down home folks that like want to give their kids a birthday party, that want to, want to go on family vacations and want to be able to just feed their family healthy food. And how do we navigate running a small business and employing those people and also having AI. I think that, I mean, I'm already having sleepless nights about it. I don't know. I don't know what the right answer is. I don't know what we're going to do, but I'll tell you what, do not listen to a podcast by Elon Musk, because he's going to have us all out of here in like 3 years and replaced by robots and all kinds of things. So I think we have very much a ethical conversation coming up. And I
Hmm.
also have a very like humanistic survivalist conversation coming up. Like, who are we as people, and how do we want to progress forward without being, left behind, but also part of the fabric of helping people and that being a community. So
Yeah.
maybe your next guest can figure that out, Nancy, and you can circle back and let me know what that answer is.
Well, yeah. So, I mean, the AI conversation is a big one right now, and that's what I do AI solutions for businesses, specifically wellness clinics, typically.
Yeah.
So, yeah, it is a big concern. There has to be, in my opinion, there has to be a human touch that you just have to maintain that, and I don't think we'll ever get away from that. But I think AI has gotten this kind of bad reputation, but we can look back and see in history where the same thing has happened over and over again. I have a friend who works at a place that still has a punch card, like
Oh,
time punching.
okay.
And he was talking about how his grandfather would talk about when they, came out with this machine where you would punch. They were worried about the loss of jobs because it used to be a person that would punch your cards. And now
Yeah.
there's this machine and you just do it yourself. And so I think it's all about like how we use the technology. And I don't think it's necessarily going to take away jobs so much as it's going to shift the labor force into different areas.
Well,
Um,
I love that perspective, because the little person who used to collect your card to punch it, when they lost their job because it was replaced with a machine, they went and found another job. And like, what did they invent? Like, what was the value that they brought in this new position that kept them on the team? So I love that optimistic view, Nancy. I will adopt that. I'll stop being so doom and gloom about it. I will just say, I guess I'm so excited to see how AI repurposes our energy and our attention to create more more improvements. I do think that's going to be pivotal
for
for
sure.
and I do think it's going to require some really creative, dynamic solutions to make it work for everybody. And like I said, I don't know it all, but I really like to. So I'm very uncomfortable with the whole conversation, because I'm not exactly sure how it's going to go. And I hope to be around for it. I hope, like I said, I hope to be 100 years old and still very much with it, and still very much active and participating in conversations that I think that matter. And I think that conversation is really going to matter.
And still coming up with new analogies.
Yeah,
Yeah.
which are just golden. I mean,
So good.
the analogies are just, if you ask my
Your
husband,
husband and your kids don't know what they're talking about.
I
All of your
agree.
analogies have been great.
Thank you, because sometimes the analogies don't hit, but I just keep doing it until I feel like they hit. So some of these analogies can really stretch for a long time, but I appreciate you recognizing that. You might be the only one, Nancy, who thinks that, but you and my mom
We'll
are the
have to
only
poll
ones
the
who.
listeners. Yeah, I think it's good. I think it's good.
Well, thank you.
Um,
I appreciate that.
Before we sign off, just tell us a little bit. Well, first, let me just say your work is truly profound, and I'm just
Thank you.
floored by the amount of information on your website that you just have out there. And that is, to me, that is radical generosity, because you're providing that information and with expecting nothing in return. It's just
Absolutely.
you've aggregated this information and you're not gatekeeping it for your own clients and patients. You're making it available to anyone. And I encourage everyone to go to your website, which is it centraldentist.com? Yep, centraldentist.com. And I'll put that in the notes. And I really appreciate you sharing all of your insights. But before we sign off, can you tell me, just as a final, How has radical generosity, this approach, impacted your practice, both in terms of your patient satisfaction and then ultimately your business growth and your reputation?
For sure. So radical generosity has been my vision for my practice really for the last 5 years. I would say COVID really shifted how I thought and solved problems and how I thought about things. Since then, my business has gone 5x in the last 5 years. So exponential growth. And it's full of patients that are like minded, grateful, excited, and empowered. And so, not every patient, but the majority. And so, the ones that aren't, they tend to self eliminate and find a different provider. But it's fun. I'm still having a lot of fun. I love meeting people. I love solving problems. I love thinking about problems in a different way. So, I think it's really brought people into my life that, again, you don't give to receive, but I have received more from my patients than I could ever give to them. I've received more from my team that I could ever give to them. So it's just a very full, happy, exciting life to live. And so I can't imagine doing anything else.
So thank you again, Dr. Jill, for your time. It has been truly insightful, and I really enjoyed getting to speak with you about all the things.
Same.
So thanks again. And to our listeners, like and subscribe, and we will see you next time.